Hi, everyone. And I want to do a very short intro recording for this week's content. Just want to remind you that on Wednesday, that would be Wednesday, February the 2nd, there'll be a quiz on the narrative matters. Nothing is broken. And I want to focus on an element of that in this podcast and have you check some stuff out. So I'm on the third page here, this section policy checklist. And it says healthcare quality measures are designed to improve care, but they too often focus on clinical processes rather than on what patients say they want or need. Now, that's very true, historically true, but I want to just show you a couple websites that really balance this out. Okay, so first of all, there's lots of what's called quality outcomes, and this narrative does a really good job, written by a physician who's undergoing a medical issue of her own, in really describing these quality outcomes, quality measures, quality metrics. And so let me share this with you here. How do I get to that? What I want to be able to do is share this website with you. So CMS.gov is the Center for Medicare and Medicaid Services from the federal government. And it's over here through this website over here that the individuals can explore, download Medicare provider data. What does that mean? Medicare is the government health insurance program that provides care for individuals age 65 and older, so older adults. Medicare providers are all these different groups, from dialysis facilities to hospitals to physicians, nurses, nursing homes, where you can explore, download, investigate the data. So you can compare, let's say, one dialysis center against another, or physician outcomes or different hospitals. It started off as a website called Hospital Compare, and now it's really evolved into this. But the issue is, now anyone can go to this and you can download tons of information. This is quality information. It's like a new language, though. And it takes a while to understand this language. Plus, you can compare, let's say, a hospital, two hospitals in the same community, perhaps, in all kinds of different outcomes. Which one is maybe slightly quicker at providing, let's say, heart care for individuals who present themselves to the emergency department with chest pain? Or how many people die in a nursing home? And so you can compare all that information, the costs for all kinds of different office visit procedures for physician offices around the country. The question is, what does that really tell you, and how do you interpret that? It becomes somewhat challenging. In fact, I would agree, I would argue very challenging and confusing, which is exactly what is pointed out in this narrative as well. So let me share with you one other site that I'd like you to take a look at as well. And this site is a little bit different. It focuses on patient preferences and patient perspectives. So in the early 2000s, really the idea was, let's start collecting patient information, their perspective. And a tool was created called HCAHPS. It's known as CAPSI as well, but it stands for essentially Hospital Consumer, that's patients, Assessment of Healthcare Providers and Systems. And it measures what patients' perspectives are on the care that they're receiving. Now, it is focused on hospitals, but because it is also controlled by CMS, Center for Medicare and Medicaid Services, there's a financial incentive for hospitals to essentially do well. There's also penalties if they don't do well. So what does it measure? It says right here, patient experiences with communication with nurses and physicians, responsiveness of staff, cleanliness and quietness of the environment, communication about medicine, drugs, everything, including the food. Now, this is surveys are administered again randomly. So it's not so much the hospitals are doing it. It is what's called the Medicare beneficiary, Medicare intermediaries who are doing it. So, but the hospitals receive the results. And so you can really, again, sort of look to see what public reporting is of what individuals think of doctors, nurses, patients, cleanliness. Now, this is somewhat, it reminds me of student evaluations of teaching, which all of you have obviously gone through. And it's done somewhat similar to an HCAP survey at the end of a course. As you can see here, the HCAP survey asks discharge patients 29 questions about their hospital stay. And so it's voluntary, for one thing. And they're well-tested questions. They're very easy. You can, in fact, go to this and find out essentially information. It is, though, just connected to patients and perhaps family members who fill it on behalf of their loved ones, patients, who have just been discharged from the hospital. And, you know, many people leave a hospital not so much in great shape to complete surveys. Perhaps there's rehabilitation, there's recovery. It depends on what they were there for. But, you know, the idea of getting a patient's perspective, the public's perspective matters, which again is connected to this narrative. Because if you're just measuring quality outcomes, nothing wrong with that, and then reporting on it, you can miss things. Now, I'll point out one last thing. The quality outcomes that are mentioned in the narrative, there's perhaps certainly financial incentives to do well. There's penalties if you don't do well, but the financial incentives for the institution and the individuals are important. So as an example, one of my, I don't want to say one of my favorite ones, but one that stands out to me as I sort of come to the end of this is how many, for physician office visits, especially for Medicare patients, how many patients who smoke cigarettes are convinced to either join a smoking cessation program or to stop completely. And so this is a quality outcome. Obviously, it's beneficial for an individual to either join a smoking cessation program if they've been smoking for a long period of time, or just stop. The overall health benefits are numerous. Excuse me. I don't think I've ever sneezed on a Zoom before or on a YouTube video. And yet but physicians are measured on how many of their patients who smoke stop or say they're going to stop. Now there's a lot of variables to this, obviously, and perhaps a physician office visit, which usually are anywhere between 15 and 30 minutes, maybe even shorter, that might nowhere near be enough time for a provider or physician to really have an in-depth conversation for an individual to either cease smoking or to think or to move towards a cessation program, although it's a measurement. And it's a measurement where individuals are also incentivized or penalized. All these things really are helpful in a way, but they can also cloud the patient visit, which is really the essence of this narrative. Okay, so what I'd like you to do is check out the websites. I'm going to put them, they're on the Blackboard site, to just so you can be familiar with it. Now, again, this is connected to the content of this narrative, but it really brings up a larger scale issue of paying attention to perhaps the science of healthcare, the science of medicine, but also remembering to balance it with the art. Okay. That's it for now. Thanks very much, folks. And of course, let me know if you have any questions. Bye.